New tonight, Washington Senator Maria Cantwell was in Spokane today to host a town hall meeting. The topic, potential cuts to Medicaid and Medicare.
KREM 2's Christian Garza was at that meeting. He's live here in the newsroom tonight with more on what they discussed. Christian?
This roundtable was full of different testimonies and statistics from local health leaders and patients as they discussed the potentially domino effect cutting these programs would have on people in communities. According to a snapshot of what these proposed cuts could look like released by Senator Cantwell, Washington State as a whole receives close to $12.5 billion in federal funding for Medicaid, and close to 2 million Washingtonians are currently using Apple Health, which is state health care for those under 19 years old. The snapshot shows that 54% of children in eastern Washington are on Apple Health, while 22% of adults are on Medicaid. In total, 30% of the total population here on our side of the state are using these services.
We're not cutting Medicaid. No, we're not devastating. We're not devastating Medicaid. Please, don't take something that is the lifeblood of healthcare to our nation and disrupt it. All for what reason? To give a tax break to rich corporations? There's no reason to do this.
In order to get both sides of this issue, KREM 2 reached out to Representative Michael Baumgartner, who says there wouldn't be any cuts to Medicaid at all, but rather more reform on who can receive it.
There aren't any cuts to Medicaid being proposed. There will be more money spent on Medicaid in the next budget than there is in this current budget. There will be some reforms to Medicaid, very likely if we're successful. It's a broken system now that has, in particular, too many able-bodied males and others that could be working. At the roundtable, the group touched on the fact that these proposed cuts wouldn't just affect patients in rural communities, but it would also affect schools like WSU who rely on rural clinics to train students, and how the loss of funding could potentially affect fentanyl treatment here in our area. Although no decision has been made on whether or not to cut Medicaid or Medicare, it will be something discussed by Congress as they finalize the 2026 budget in April. Christian Garza, KREM 2 News.